Hi, everybody. This is Kelly Friedlander. Thank you so much for joining us on our first Lunch and Learn webinar, Supported Living 101. Today, we're going to be going over some of the basics of supportive living, including the philosophy of supportive living and also the rules. Jesse, would you like to take over?
I would just like to thank everyone for joining us today. We have Trish Barnum, Steve Strom, Kenneth Bossell, all prepared to present about supported living for us, and we're very excited to kick off our webinar series with this presentation. We will be trying to offer a webinar at least quarterly for the remainder of the grant. So with that, I'll pass it off to the next presenter.
Hi, you all. This is Trish Farnham along with Steve Strom, our new Money Follows the Person project director. We are very pleased to be a part of this conversation today and with future conversations. And our task today, very briefly, is to provide a bit of background on how this particular initiative came together and some of the supported living philosophical tenets that hopefully undergird everything that we're trying to accomplish here through this wonderful supported living service definition. So you can go to the next slide, Drew. Next slide. There we go. So just as a bit of backstory about how the Money Follows the Person project came to be involved in this effort is, as folks on this call may know, MFP is a demonstration initiative that assists individuals to transition out of various long-term care facilities and back into their homes and communities. And as we worked with our partners in the intellectual and developmental disability community, it became evident that many families who had otherwise been reluctant to support their child to live in non-institutional settings and return to their communities really were interested in having a really person-centered option and having the option of people live in their own homes where services could be fully tailored to meet that person's needs. And so from that, MFP became a real kind of investing partner in the state's effort to expand the access to the concept of supported living. Just to give people a bit of a foundational understanding of what the supported living concept is before we get into the specifics of the definition, it's listed here, or a summary statement is listed here on this particular slide. And really, the North Carolina program has really relied heavily on John O'Brien's seminal article of Supported Living, What's the Difference?, which was sponsored by Syracuse University in 1993. And within that article, John O'Brien articulates a supported living philosophy of being a person with a disability who requires long-term publicly funded organized assistance, allies with an agency whose role it is to arrange and provide whatever assistance is necessary for the person to live in a decent and secure home of the person's own. Next slide. Drew, you can go to the next slide. Thanks. So within this seminal article in 1993, O'Brien also really articulated a concept, or articulated a particular design of what supported living isn't, recognizing that the philosophy of supported living is potentially different or an enhancement on the philosophy of many IDD services. He also drafted this diagram, which reflects kind of what supported living as a concept is and what supported living as a concept isn't. And so as you look at this slide, and this slide is also reflected in several of the other materials we have published since the supported living definition went into effect, but you'll see that it's important to acknowledge what supported living is, which is a safe and decent home of your own, choice, personalized assistance, and support from others who care about and respect you. Some of the things that supported living isn't is a test to see if you can live with no problems, and if not, you get sent back to group living. It is not intended to be a function of segregation by disability or income. It is not having permission to live in an apartment controlled by an agency. It is not simply signing a lease on a place that staff control. It is not a kind of slot or bed with a prerequisite entry and exit criteria, and it's not an incentive for reward or for good behavior. So the ones that I listed simply reflect a few of the elements that are reflected on this diagram, but hopefully that gets everyone on the call thinking about what we are trying to accomplish through this definition, both in advancing the concepts and the philosophy of supported living, and also really trying to avoid some of the ideas of what supported living really isn't. Next slide. So when it became evident that the supported living concept was really taking hold in North Carolina, MFP partnered with our wonderful partners at the North Carolina Council on Developmental Disabilities to release the Making a Difference, or Making the Difference procurement opportunity to really try to invest in ongoing technical assistance to individuals who are experiencing the supported living definition and those organizations that may be also assisting them. In addition to that, in recognition that the supported living concept and philosophy really requires all of us to think perhaps a bit differently than we've traditionally thought about services, we also created an expectation that the Making a Difference vendor would also facilitate and support a learning community, and which is part of what we are doing here today. So just to very quickly highlight the goals of the Supported Living Making a Difference partnership, it's to develop a statewide capacity building learning community. It's to coordinate opportunities for organizational partners and other identified members of the learning community to receive technical guidance. It is to demonstrate a successful implementation of the supported living definition through real people, examples of real people, and to develop a method for shared learning and success stories for individuals not participating in the effort. So it's important to know that last fall, VIA was awarded this particular partnership, and that's part of the reason they are doing this today. But in addition to the learning community, it's important for folks to understand that this grant really addresses or examines the supported living experience of specific individuals and works to assist them to begin their supported living services if they haven't otherwise begun them. So in addition to global and statewide learning opportunities like today, the grant is really intended to follow and to support this supported living experience of identified individuals that are outlined within the VIA's contract. So next slide. So like with all learning initiatives, this one is certainly about learning what works and what doesn't, and working with our state partners to tweak and refine our approaches and our definition as needed to really honor the concept of the supported living philosophy. Next slide. So in order to really try to bridge the supported living philosophy to the operations of the supported living definition, there has been a group of folks largely requested by the MCOs to think through how do we honor the tenets of the supported living philosophy as we really look to see how people are experiencing the supported living definition. And in doing so, we have been working for nearly a year now to think through what are those essential elements of the supported living definition that really make sure that the supported living concept and the philosophy are honored as the definition is implemented and rolled out. So on the right side of this slide, you see some of those key essential elements that the state really believes are important and critical for the supported living definition to be operationalized in a way that honors that supported living philosophy. And so these are listed here, and they are, I'll just read them off quickly, that people live in their own homes, that people are involved in hiring and training their own staff, that people choose who live with them, that the agency is constantly learning about what is working and what isn't working for each person, that people's schedules are tailored to meet their individual interests and needs, that people control their own money to the extent possible, and providers are partners in supporting a person's community life, and people have dignity of risk and dignity of experience, and people feel safe. So as we work to provide oversight on the supported living definition, we recognize that these are the elements that are critical to be in place in order for that supported living definition to be in effect. Next slide. And this is my last slide. Just as an extension of that intent, we are working with our MCO partners to really think through how do we do this how do we examine these essential elements in a very thoughtful and organized way, certainly before we do any sort of formal enforcement of this particular service using these essential elements. We want to make sure that these essential elements do in fact reflect the philosophy as it plays out in individuals who are using the service definition. So for this fall, we will be launching a pilot where we work with partnering care coordinators to examine these essential elements and to think through them with individuals who are currently using the supported living definition to see if it truly reflects their experience and to see if there are other elements that we need to maybe consider. In addition to that, VIA, as part of its Making a Difference learning community, will also be testing these essential elements with the individuals they are supporting in the supported living definition, again to see do they accomplish what we're hoping to accomplish of having a clear structure for evaluating the supported living definition in a way that honors the supported living philosophy. So we will be using the Making a Difference communication channels to get additional information out there about these, thanks to many of you who already provided feedback. This will hopefully help inform our state's process and state service definition moving forward. So with that, I am turning it back over to Kelly and Jesse.
Great, and now up we have Kenneth Basal from the... Wonderful, thank you so much, Trish. Next up we have Kenneth.
Okay, so I'm Kenneth Basal. I will be doing the next kind of part of the presentation. And we'll be going over... Drew, I might need you to actually move my... Okay, never mind. Okay. So my name is Kenneth Basal. I am the manager of the department at the Division of Medical Assistance that works predominantly with people with intellectual and developmental disabilities, so the innovations waiver falls under there, as well as people with traumatic brain injury and things like autism spectrum disorder. So today, after we heard from Jesse and Kelly and Trish, we're going to hear a little bit about the Centers for Medicaid and Medicare Services, CMS, and how waivers are funded, the 1915 BC waiver overview, so those are things like our LME MCO systems, so things like Alliance, Trillium, VIA, Sandhills, East Point. We're going to go over innovations, just a brief overview what it is, and then go into supported living, and supported living is a tool, or one tool within the North Carolina Innovations waiver. So I wanted to kind of break it out this way, so that you understand how the funding comes from Medicaid or our federal partners that allows for this managed care environment with the LME MCO systems. They operate this 1915C waiver, which is the innovations waiver, and supported living is a tool within that waiver. Oops. Okay, so Medicaid home and community-based waivers are authorized under Section 1915C of the Social Security Act. And these waivers allow states to provide services and supports that are outside of the Medicaid state plan. So again, the innovations waiver is a 1915C waiver. And we'll talk about the BC component a little bit on the next slide, but basically Medicaid waivers are authorized under the Social Security Act, and they allow us or states in general to provide services and supports that are outside of the state plan or in excess of the Medicaid state plan limits in order to support people in their home and the community. So again, it's services in people's communities, not in institutional settings. It allows states, and of course North Carolina is a state, to waive certain requirements, like eligibility requirements. With the waiver, we can look at the income of one person. So that's why a lot of children who have families that are, have substantial wealth or assets can get on the waiver because we look only at the income of the child. It can allow us to waive things like geography. So it could be in one part of the state and not the whole state. The innovations waiver, however, is in the whole state. And it allows us to offer things outside of the Medicaid state plan. So when you think about services in the Medicaid state plan, you might think about skilled nursing facilities, intermediate care facilities for people with individual and intellectual disabilities, physical therapy, private duty nursing, things like that. So the innovations waiver, because it is a waiver, can provide services and supports outside of what's in the Medicaid state plan. And the waivers always have to look at an institutional level of care. So I mentioned in the state plan, there's things like skilled nursing facilities and ICF-IEDs, or intermediate care facilities. So the innovations waiver is looking at that intermediate care facility level of care, and we're able to provide services outside of the state plan for that population. So funding, for our waivers, we get funding from CMS and the federal government. And what that means is that there's a match. So for each dollar we spend, we get so much money from the federal government. For us, it's right around 66 cents. So for every dollar that we spend, 66% or 66 cents comes from our federal partners, and the rest comes from the state. So it really allows us to do more things in the community. And those matches vary for different states. So places like California and Mississippi, their match isn't as high. So they spend more state money than federal money because they have stronger economies, whereas places like Mississippi, they get more federal funds. So now this is the 1915 BC overview. So this is where we currently are. The BC waivers would kind of allow the LME MCOs to exist. So this graphic shows that the innovation waiver sits in that 1915B waiver, making it the combined 1915 BC. And this allows the LME MCOs to use managed care authorities and pair those with the innovations waiver. So those managed care authorities are things like a closed network. So not every provider, it's not every willing provider, so they can limit the amount of providers within their system so that they can make it work for their populations. They have rate setting authority, so if they get tentative rates from the state, if those don't work for their community, if they need to raise something to incentivize it or lower another service rate to de-incentivize, they can do that. And then also what we see is that BC waiver is it allows for the innovations waiver services to come through the LME MCO, but it also allows for people who may have substance misuse needs or something like that to receive those services also coming through the LME MCO provider network, so things are more integrated and care is better coordinated. And again, the BC waiver and the LME MCOs, those are things like Alliance, VIA, Trillium, Cardinal. Okay, so now to the North Carolina Innovation Service Array. So if we think about it again, the Innovations waiver is a 1915C waiver. So it's for people with intellectual and developmental disabilities, or for people who have related conditions, things like cerebral palsy, or if they had a brain injury before they were 22 years of age. And it offers a set of tools or services that are outside of the Medicaid state plan to keep someone healthy and safe in their community, as well as helping that person get to the life that they want. So supported living is one of those tools. So we're just going to kind of read through some of the services real quick. So we have base budget tools, and these services are predominantly things that are used on a day-to-day basis. So things like community networking service, that's for people to receive services in integrated environments, so things like going to school, volunteering, things like that. Support employment, so helping people work. Day supports is predominantly a facility-based service where people can go during the day. Community living supports is a good blend of personal care and rehabilitation and respite. So those are some tools that would help someone get to the life that they want, and also tools that would keep them in their community. Okay. Then we have our second set of tools. These are our non-base budget services, and with the exception of residential you see down here in supported living, these predominantly are things that we use more as a one-time cost or as needed, and that's why they're outside of a base budget kind of paradigm. So Community Navigator, which is formerly Community Guide, so helping people really look at their community resources, get linked in with their community, look for housing, if there's an issue with Social Security or if there's an issue with Medicare, helping with that kind of thing. We have Community Transition Services, which helps someone come out of a licensed facility like an ICF-IED or a group home or even their family home to a home of their own, and it can give you some startup costs. Home modifications and assistance technology. These are types of programs where you can get some funding to modify your house or implement some smart home technology so you can be more independent in your home. Okay. And then we have individual goods and services, natural supports, education, and specialized consultative services. Again, things that you might use as needed. Okay. So we're going to focus in on the supported living, and this is that tool within the toolbox to help, one of the tools within the toolbox that you can kind of pair with the other services to get to that life that you want. Okay. Supported living. So again, just to be redundant, it's a service definition tool in the Innovations Waiver that enables people with disabilities the opportunity to live in their own home. So again, supported living is only available for people on the Innovations Waiver, so they have to meet the level of care, there has to be a slot. And simply put, again, this tool can be paired with the other innovation tools or services to help someone get to their meaningful life or more independence. So for example, which we just talked about, someone could use community transition to get out of either a group home or their family home to their own apartment to use supported living. That could help pay for some startup costs. Or they could be in a supported living home, and for their daytime or some evening time, they may use supported employment to help them secure and maintain a job. So again, supported living is a service to help people live on their own, but we always want to pair it with other tools to make sure someone has a well-rounded existence. Okay. So where is the power and the responsibility? So this kind of goes back to what Trish was talking about, or reframing what Trish was talking about. You know, the power and the responsibility is with the individual. So the person, you can see them in the circle, their friends or their family or their support network. The provider isn't the one who's setting up all the rules, but more adapting to the rules that work best for the person. Okay? So because it's the person's own home, the power and responsibility sits with the individual and their family, friends, allies. And again, the provider should ideally come into the situation and support the person, so adapting to the rules that already exist. And this really goes back again to what Trish was talking about, is that philosophy of self-direction and self-determination. And we can talk about how supports are structured. In this kind of paradigm, supports are structured based on the person's interests, their preferences, and their needs. Each person using supported living is going to have different needs. They're going to have different interests. They're going to have different preferences. So their scheduling needs are going to be different. Their staffing needs are going to be different, that kind of thing. Their staffing pattern, when they get their services, may be different. We talked about on the previous slide is that someone may pair supported living with supported employment. So one person may work during the day, so they may not need as much support during the day. Another person may work during the evening, so they need more staffing support through supported living during the day, and then they have less in the evening. Okay, so where is there more evidence of this? The individual with friends and family established the house rules, developed the roommate agreement, and developed the staffing patterns. So again, that's kind of the context that the provider comes into. Okay, and then if we think about it, how is that different from something like a residential provider? Residential providers also try to do a good job of looking at what the person's needs and what they supports they want and their staffing patterns. However, if someone's moving into a residential setting like a group home, they're going to be moving into an environment that typically already has rules, more than likely has licensure requirements, and may have other house members that the person has to conform to. So again, it's someone creating a context for themselves with supported living with their team versus a provider-driven kind of setting where someone's moving in and adapting to the rules of the provider. So as just a quick overview of supported living, it's a daily service for people who live in their own home. It's up to 3 adult individuals may live together without licensure. The home may not be rented or owned by the provider, and the supported living provider or the supported living service may include live-in caregiver, and then the level of support is based on the SIS level. So just to kind of go over some points of this slide, a person's own home is defined as the place that the person lives in which the person has all the ownership or tenancy rights afforded under the law. So it's the person's home. They either have the lease or the mortgage in their name, or if they have a guardian or some partial guardianship, it's in that person's name. It's not it's not in the provider's name. Also, to go back to the level of support based on the SIS, this is very similar to how North Carolina Innovations residential supports works, except for residential supports, there's 4 levels. For the SIS, there's 3. So level 1 is A and B, level 2 is C and D, level 3 is E, F, and G. Okay, so it's the level of support that the person gets for supported living comes based on that SIS assessment. Okay. Where can the person live who uses supported living? We talked about this a little bit before. The person can live in their own home, and they would live in a place any typical person without a disability could live. So again, it's community-based. It's a place where they have tenancy rights, they have the lease, they have the mortgage, things like that. And a person can choose or change their service providers, and that change doesn't impact their ability to stay in that person's home. So if you think about it, if you're in a group home and you don't like your provider agency, typically you're going to have to find another provider agency. Supported living is a little bit different, whereas it's your home, things might not be working out with your supported living provider. You can choose another provider that you think may be able to adapt more to your house rules. So going back to what Trish was talking about before as well, is that trying, learning, assessing, tweaking. Some of the things that we've heard that we've been learning as we've been going is people had questions about, can an individual with a legal guardian access the service? So again, if someone has a legal guardian or partial guardianship, that person can either rent the place to them, they could have their name on the lease, that kind of thing, because we know that there are a lot of people on the Innovations waiver that don't have full guardianship that would also like to take part in this. So how old do you have to be? You have to be 18 years or older, and that's just so that you're an adult. So it's not a service for children. Who can you live with? You can live by yourself, a roommate, a family member who is also receiving supported living, your spouse, a minor child, or a live-in caregiver. And theoretically, you would choose your roommate based on your preferences and mutual need. It's also important to note that if you choose to live by yourself, your support needs must be met within that $135,000 innovations cap. Again, because we're looking at ICF, IID level of care, that intermediate care facility, to ensure cost neutrality, which CMS needs, we have to stay beneath the $135,000 for each individual. So if someone has higher support needs and they need more staffing support, they may want to consider living with another person who has the North Carolina Innovation Service so they can share some of the staffing costs. All people receiving supported living who live in the same house must be on the lease unless the person is a live-in caregiver. And that's important just because you don't necessarily want the live-in caregiver to have rights over the household. And the reason for that is if things aren't working out with your provider, your live-in caregiver, you don't want them to be able to stay in your home when you choose to get somebody else. Okay? So how many people can you live with? And this is a maximum of 3 adults. And it's important to note that that 3-person limit can be exceeded if the person's living with minor children. So if you had an individual who is married and they had 3 kids who were minors, that would be okay. It's just a maximum of 3 adults. And what that does is it allows people to live together who have disabilities, and it doesn't have to be a licensed environment. So that's kind of what allows supported living to happen. If you look at Session Law 2011-202, House Bill 509, that allowed for people to live together, up to 3 adults, which allowed us to start developing the supported living definition and the philosophy of self-determination. So that was a very big victory. So what are the coverable activities of supported living? And these slides have a lot on it, and it comes basically from the definition that's in the waiver. Is it provides a flexible partnership. So again, that goes back to what we were talking about before and what Trish was talking about before too, is that the individuals, it's their own home, they have a flexible partnership where the provider should be able to adapt to the rules, the roles that the individual wants and their team wants. So it provides for daily living assistance, assistance with household chores, assistance with budget management, and this is important too because it has assistance with budget management, but the individual should have control over their money as much as possible. So if they had something in the past where they've consented to have assistance with money, that's different, but the individual has control over their finances. It assists people with attending appointments, and it also monitors health, physical assistance, transfers, and mobility. And we thought that those last 2 bullets, or 4 points, is really important because we wanted to put in the waiver and in the service definition that this isn't just for people who are, the service isn't just for people who are more independent, but also for people who may have more physical support needs or may have more needs associated with just general supervision. That could be monitors health and physical assistance. That could be related to behavior as well. If someone's had a history of behavioral support needs that puts their placements in danger, supported living can assist people who have those higher support needs as well. Also in the definition, it talks about assistance with interpersonal and social skills that enable the person to live in the home and the community. So really looking at how they can interact with their new community and develop a community around themselves, which I think is really important as well. So learning from risk. Philosophically, something that's in supported living and something that we've heard a lot from the community as well as for individuals with disabilities is that they want the chance to take risks in order to grow. And I think that that's how almost all of us in the world grow, is from taking chances. So we built into the definition that individuals may have unsupervised periods of time, and that when someone's going to have unsupervised periods of time, that should be mapped into their person-centered plan or their ISP about, you know, why the person wants to do this, what the safety measures are, that kind of stuff, so that there's buy-in from all sides. From that unsupervised time, it can also look at telecare options like assistive technology. So how you're going to use different technology in your own home to possibly have less one-to-one staff time. So that's something that we really want to help perpetuate as a state and as a culture for people to do. And this is also important when we look at kind of those relationships between the person and their organization, because they would develop joint agreements and commitments around this risk with each other. So we have to think about it as flexible, as supported living as a concept that's flexible and it's not stagnant. So someone may come in and need a whole lot of staffing time up front, but as they get more used to their home, they might get used to their roommate, whoever that may be. They might get used to their live-in caregiver, their community. They might want to try to have some time alone or try to do some of the things that they've been doing with staff assistance by themselves. So that would be building into this learning from risk and really trying to change the rules and expectations and allowing someone to do so. Okay. So exclusion. So that was the basic meat of the definition. There are exclusions in the supported living waiver, just so that we feel like it will work. It does not reimburse for room and board, with exception for the reasonable portion attributed to the live-in caregiver, and that person has to be unrelated to the individual. And the reason that this is that Medicaid can't pay for room and board for the person receiving services. So supported living, as a definition, can't pay for the housing costs, the rent, that kind of stuff, but it can, through the rate, assist with paying for part of the live-in caregiver or reimbursing for it. Again, right after that, another Medicaid rule is that supported living and Medicaid services cannot reimburse for the cost or maintenance of the dwelling. So that's something to think about for, if an individual wants to try supported living, they have to really work with their team to decide, how they're going to cover maintenance, how they're going to, if it's the actual house, how are we going to afford cutting the grass if the person can't themselves, things like that. So, with home ownership and with renting, a lot of other expenses kind of come up. So really mapping those out before you go in so that, when the grass gets too long, you don't get the notice from the city with a fine or something like that. Supported living also cannot be provided in a licensed setting. So again, another redundant kind of point, that this is the person's own home. It's not a licensed setting. It's not controlled by the provider agency. And more importantly, it's not, within that state system where it's licensed and there's auditors coming out. And currently, it cannot be a self-directed service in the innovations waiver using either the employer of record model or the agency with choice model. Okay, so what we've learned, So what we've learned from barriers, what we've learned about barriers and opportunities, and this again goes back to trying something, learning, and then tweaking. When this service came out, we immediately thought, and we heard from the community and individuals who receive services, that self-direction should be an option. So we've been working with our Innovation State Stakeholder Work Group, and we are confident that we're going to move forward and allow this to be self-directed using the employer of record and the agency with choice model. So then that's going to also be a barrier of sorts of how do we get people up to speed to be able to do that self-direction because we don't have that many people on the waiver who actually self-direct. Another thing that we've heard that's been a barrier is just support for the transition. And this is twofold. It's psychosocial support for the family and the team of the individual kind of coming to terms with the fact that their loved one may be moving out and be living by themselves. And then transition also is, how do you plan for this? How do you learn about housing options? How do you interact with the North Carolina Housing Finance Agency to get an affordable mortgage or rental assistance? How do you build these house rules and find an agency that's going to be flexible, or, who's going to be doing all that talking with the agency to make sure it's a flexible relationship? So what we're looking into is building possibly a modifier on the supported living definition to allow for some assistance for the provider or for someone else to assist with that process of someone transitioning into a supported living environment. Something else that we've heard that's been a barrier is just affordable housing in general. Finding places that people feel like are safe or feel like they're comfortable, that's also affordable. Getting access to that, in certain areas there's more access than others. And then this also goes back to special assistance. For everyone in group home or licensed facilities, they get a certain amount of special assistance, which is payment, right? For people living in their own homes, some places there's actually waiting lists for special assistance, so trying to work through how that works. For level 3 support and technology, in our definition, we said that someone who was at level 3 had to have awake overnight staff, and it couldn't be through technology to provide that support. So what we've heard from the community and from our stakeholder group is that needs to change. So we're changing that as well. because it is based on the SIS, we want it to be more flexible for the person and not have a mandate that someone needs to have awake overnight staff, because that can actually lead to that increased cost as well. And then how to provide backup staff support. So what we've heard from a lot of individuals, families, providers, is that what happens if staff calls out? What happens if backup staff isn't available? You know, how do we make that happen? So really working through these things in a meaningful way to try to find solutions. So again, what we've learned, what we've tried, what we're going to try to tweak to keep this as a reflexive process. And again, like the definition isn't stagnant, we can't be stagnant on our side as well. So that's it for my piece. I think I had us, okay, there we go. Thank you, guys.
Okay, thank you, Kenneth. I'm Jesse Smathers with VIA Health. I'm our Specialty Populations Clinical Director, and I get the good fortune of just sharing a few success stories today instead of going into the nuts and bolts like Kenneth had to do. Next slide, please. Okay, I titled the next two slides, It's My Home, and that's tied to a video that I shared with the learning community through the email exchange, and it's a man that is singing a song, It's My Home, because he's in his own place and he doesn't have some of the rules and restrictions that people have in group homes or other congregate living arrangements. When I was putting these slides together, I didn't realize until just now that I ended up putting the names in alphabetical order. First person I want to tell you about is Austin. Austin's 20 years old. He lives in Jackson County. That's in the western part of the state, near a town called Silva. Western Carolina University is in that area, and it's a college town. He moved into his own apartment in August. His brother was going to college. His younger brother was going to college in Alabama, and it just made sense for him to move out of the home at the same time. Austin moved in with a live-in caregiver. The home is Austin's. There's an extra room where a young lady that he sees as a roommate lives. She receives a reasonable portion of the supported living cost to be available if anything happens at night. She sleeps there. She has some free time when Austin is directly with his parents. And Austin is also receiving about 30 hours of services through supported employment and community networking. It's pretty unique the way Austin's arrangement is set up, because he's receiving supported living level 2. He has a live-in caregiver, and the supported living provider also supports him close to 15 hours per week on top of the live-in caregiver piece. And he's receiving supported employment and community networking as a self-directed services. His mother's his employer of record for those services. And since the transition, things are going really well. He just told his mother last week when I was asking for information about the stories about, he felt his life was really awesome. And Austin has fairly severe autism and is doing really well. Picture to the right, Barbara. Barbara's been in services for almost 2 decades. She's lived in institutional settings, several different congregate living arrangements, and a number of alternative family living arrangements, or AFLs. 3 years ago, Barbara expressed a desire to live in her own apartment, her own place, and now she has one in West Asheville. She moved in the fall of last year. When Barbara was living in her AFL, she was receiving close to 12 hours of support each day. And there were alarm systems on doors, and this was just to maintain her safety. As she settled into her own apartment, her team's worked with Simply Home, and different pieces of technology have been set up to where she's staying safe in her home with about 6 to 7 hours of services per day. She picks when she receives her services. She's also receiving supported living level 2. And she does not have a live-in caregiver. She's on her own because of the technology. There's a number of things in the apartment to ensure her safety in case she doesn't turn things off or if she's not using things in the right way. She's currently employed by the town of Black Mountain. She is very social, and she is, for the most part, in control of her money, and she's choosing to live her life as she likes. Over the last few years, and especially since Barbara has become more independent, she has gained control of her diabetes through diet and exercise. And she says that she feels great anytime you see her, and she's always smiling, like in that picture, now that she has the autonomy that supported living has offered her. She's served by Liberty Corner Enterprises, and Austin is receiving services through First. Next slide, please. Jennifer moved into supported living level 3 at the 1st of September. She grew up in her family home, and she's lived in a number of 6-bed group homes. She moved into her apartment out of a 6-bed group home. Jennifer has a housemate that is not really responsible for any services at all. She just is there, and she is like a roommate, and she can respond for some of Jennifer's physical needs, because Jennifer's her mobility is through a wheelchair, and she has some pretty complex medical support needs and needs someone with her or readily available to her. She does lots of meaningful activities through the day, is very upbeat. She's living in Asheville, and in Asheville throughout the summer on every Friday night there is a drum circle where a lot of people in the town gather right in the central part of town, and she joins that activity for the drum circle just about every Friday. She enjoys going to Asheville tourist games. That's our minor league baseball team. She recently had the great opportunity to see the Beach Boys at concert in Biltmore State. She saves money to do these activities with her Social Security and, of course, her job. She is exploring the use of more technology because we believe there's some things that will give her additional independence. Next, Jennifer's picture is Tammy. Tammy's living in an apartment with her husband in Woodfin. They have 3 cats. And Tammy's been on the Innovations waiver for almost 14 years. And she's lived in a variety of group home settings. And in the past, she's tried apartment living when it really wasn't a specific service, but just with some periodic supports. And the apartment living never worked out that great for Tammy when there wasn't flexibility, because she has a number of needs, both mental and physical, and she's also likes to have as much control of her time as possible, but she has great difficulty navigating social interactions and relationships. Tammy, when she moved into her apartment, she was living in a group home, and her husband was having to live in another setting also. When they finally got an apartment together, they have been doing really well. At one point, Tammy was receiving about 11 hours of services a day, but in this supported living setting, her services are very fluid, and she only has people helping her and supporting her when it is most necessary. She has a lot of control over her schedule, and she's always had challenges finding staff that really work well with her. having more flexibility and the ability to tell staff that she doesn't want them around a specific amount of time has helped with her maintaining staff. Her and her husband are both now working towards finding a home of their own beyond an apartment. They would like to purchase a home one day. And her team's supporting her in that quest and trying to connect them to the right financial options. So there's 4 success stories that we have. We've moved several other people into supported living, and we're putting together additional success stories with pictures. And we'll be preparing to share some videos of people that are living in their own home as we get into next year in the grant. Next slide, please. One thing that we've seen as a challenge in helping people transition to supported living is the way the system has historically protected people with intellectual and developmental disabilities has been a barrier, because often we automatically think that a person has to have someone with them 24 hours a day, 7 days a week, when that's not always the case. It's just the way it's always been. And also you have provider agencies that are really reluctant to not monitor a person 24 hours a day, 7 days a week, because they're receiving payments from Medicaid, and see that as their responsibility and worry about liability. So our next webinar will be during the lunch hour on Monday, December 11th. And the topic that we're going to talk about is Kleiner Citizen, health versus safety, risk versus liability. And I'll be presenting that with Derek Dufresne, and we'll hopefully give folks a better understanding of really seeing the person receiving services as more of a citizen instead of a person that needs our help. You know, a person that gets to choose what they want in life and just needs a little bit of support to do that, or sometimes it may be a lot of support, but the support they receive to help them make their own choices and their own decisions and to live as independently as they can. That will be the topic of our next presentation. Again, that will be December 11th, from 12 to 1, Kleiner Citizen, health versus safety, and risk versus liability. We look forward to that webinar opportunity too. That's all I have. Thank you. And I'll turn it back over to Kelly.
Jesse, this is Drew. I think Kelly might be having some technology difficulties. So just to let everyone know, any questions submitted, we will send over to Jesse, and he will send those out with written responses. And with that, we will go ahead and conclude our webinar today.
Okay, thank you, Drew.
Thank you.